What brought us back to Kansas City was family. My wife comes from a very large family, and so we decided what was most important was family. We missed the weather in Colorado, but family definitely trumps that. My family is in Oklahoma, so we're close to them too. So in regards to my philosophy about internal medicine, the thing that makes internal medicine physicians unique is that we've trained to manage multiple chronic conditions simultaneously. I think we all have our strengths in different fields of medicine, and the strength in internal medicine we have is being able to keep a lot of balls in the air very well. And that's what we do, that's what we're trained to do. And so the patients or the people who have one problem, high blood pressure, that needs care too, but that's not really playing to an internal medicine doctor's strength. An internal medicine doctor's strength would be someone with high blood pressure and diabetes and hepatitis C, who's also has celiac disease. That would be something where internal medicine would really shine. When I care for my patients, I think one of the most important things, if not the most important thing, is that relationship. I had worked in the hospital as a hospitalist for a period of time, and then decided to get out of the hospital because it didn't have that relationship. You have to have that relationship so that you can develop trust, and trust is the basis of all treatment. If you don't trust me that I have your best interests in mind or that I know what I'm doing, then obviously you're not going to go along with me, and I have to trust you that you're going to tell me what you need to tell me, and you're going to be open and honest with me to allow us to have a really good relationship so we can get the best care we can for you. My patients probably enjoy my attitude and my disposition most, and also probably the fact that I love to teach. And so even though they're not residents or medical students, I wind up teaching my patients and explaining disease processes and kind of walking them through what's going on. So the choice to go into internal medicine, it's a complicated one that I really don't have a solid answer for. I come from a family of medicine. My father was an internist. Internal medicine is a very well-respected field. We're often called the doctors because we know so much about everything. But really, for me, it was the puzzle, the way things fit together and how the body all works together. I think more and more we're trying to isolate organ systems, and that doesn't work because they all fit together and work together. And internal medicine really has that perspective and that viewpoint of many systems working together to form one unit. The thing that I enjoy the most about practicing at AdventHealth is that AdventHealth has a mission. They have a goal, and you can feel that when you work here, that it's not a for-profit institution. It's not to try to get as many people as they can. They have a real interest in the community. They have an interest in, the physicians and trying to deliver the best care that they can, which is different than a lot of hospitals and health systems out there. It's very unique. My name is Matthew Swan, and I'm a primary care provider for AdventHealth.